specific skin ailments, preventatives, therapeutics. Um, Talk about acne. The first three are actually the same subject. Actually, the first four are the same subject. So that's all combined. Part one, it's skin functions for protection, temperature regulation, sensation. Acne or pimples occurs in over 35 million people from ages 8 to 50. Usually clears by 18 to 20, but not always, and can persist in later years, especially in women. Flares with hormone changes during the menstrual cycle. Its causes are blockage of the oil glands. There is a bacteria that may be involved with it, the action of hormones on the oil gland and the skin. All three of these combined cause inflammation, and then you get pimples, and then in people from India and the subcontinent area, they tend to hyperpigment and scar quite easily, especially younger individuals and women as well. Occurs on the oily portion of the face, upper back, chest, and upper arms. Can occur on the thighs and the abdomen as well. This is the normal unit. You can see A is the canal, B is the gland, so it's called the sebaceous gland. C is where the bacteria resides, and D and E are the first two layers of skin. The problem is in that canal, it gets all blocked up, and no cleanser, no agent really other than certain things can get down there to unblock the gland, to unblock that canal. So that's the key. So washing your face excessively will not make acne better. These are comedones. That's the first signs of acne. Those are little bumps underneath the skin. You can see some of them have become inflamed and formed pimples. The little white bumps you see, they're called blackheads or whiteheads. They're underneath the skin. They're like little fine grainy bumps. That's a blackhead. That's in somebody older with sun damage, but that's essentially a whitehead and a blackhead are the same process. A blackhead is just an open whitehead. It's just the blockage of that canal creates this mass of oil, and that creates this little bump. And the bump is either open or closed. And if it's open, it's dark. The top is dark because of the oxidation from the air of the oil that's in the skin. There are a bunch of blackheads and whiteheads or comedones on the chin of a woman there. Very common area to get it. Very hormonal. This is where the layers of acne can occur. Then if those blackheads and whiteheads become inflamed and form pimples. You can see little bumps on the nose here. That's the precursors. And they become red and inflamed. And can also leave some scars that you can start to see. That's the inflammation. And when people pick at them, squeeze them, do stuff to them, they can become very inflamed, more inflamed, and then they can leave scars. And you can see the little white. Go back for just a second. If you look in the middle of all those red guys, there's a couple of little holes. That's a blackhead. So the blackheads, when it becomes inflamed, become formed a pimple. This is more severe. The jawline can leave scars. It can be difficult to get rid of the marks. You see some pigmentation and some redness. And then you have a lot of scarring on the back. It's not very easy to treat. Difficult to make better. So there's some more scarring on the face because of all the pimples that were not treated, or this may be even treated, but a bit late. So this is someone who's been treated. You can see all the scaling from the medications. It's quite dry. And it's been left with flat red scars, which are not that difficult. So there's topical medications to open up the oil glands, Retin-A or tretinoin, Differin or Adapalene, and Tazorac or Tazarotene. These are the three main ones. Now there's a couple of new ones. One's called Aclief that's come out. It's quite good. And then you can use topical anti-inflammatories like benzoyl peroxide, Clearasil, Proactive, prescription versions, clindamycin, erythromycin, and combination products. These are old but effective. Proactive is just Clearasil, just more expensive. And we can also do oral antibiotics, Accutane, birth control pills, and minor procedures. We also do something called spironolactone, which is a male hormone blocker, and several new creams are coming out that block the action of male hormones on the oil glands. So there's lots of new stuff coming.